Hi there, welcome back. In today's video. In this tutorial I'm gonna show you how you can administer esomeprazole sodium for injection. So in today's video I just want to show you how you can simply dilute and prepare esomeprazole for injection, which is anti-ulcer, which is falls under the group of proton pump inhibitor. It kills any bacteria or any acid that grows in the lining of the stomach. So before you start, make sure you gather all the supplies that you require for you to perform. You will need adhesive plaster to secure the cannula. You will need a syringe. You will need a 21 gauge needle. You will need a cannula. You will need an alcohol swabs. So you will need disposable goldfish tubes as a tiny cube. You will need a cotton wool for you to apply pressure on the area where you have given the shot. Then what you do, make sure first you introduce yourself to the patient. You gain consent for you to continue the procedure. Then what you do, first make sure you start by securing the cannula. So first make sure you secure the cannula before you start administering the drug to the patient. You get an alcohol swabs. You clean the vein with an alcohol swabs. Then what you do, you get the cannula and remove the cannula from the packaging. Make sure you attach first. So this is how you are going to secure the cannula. I hope you can see there's a primary flashback in the jump of the cannula. You pull back the needle slowly. You will see a secondary flashback. Then you advance the cannula deep into the vein. You release the tourniquet. Then you remove the cap of the cannula. Then you remove the needle from the cannula. Then you attach the cap of the cannula first. This is how you are going to secure the cannula. Then what you do, you get the adhesive plaster or strapping for you to dress the cannula. So this is how you are going to dress the cannula. So this is how you are going to secure the cannula. So this is how you are going to secure the cannula. Then when you finish securing the cannula, then what you do, you start diluting the drug now. You get the syringe. You remove the syringe from the packaging. Then what you do, you get the needle. You remove the needle from the packaging. Then you get the syringe. You attach into it. Then what you do, you put the syringe into the packaging. You get the esomeprazole sodium for injection. Then make sure what you do before you administer, make sure you check the labeling of the drug. That is method of administration for IV use only. Then what you do, dilution. So you have to dilute with 10 ml of sterile water for injection, that is sodium chloride. Then you have to check the expiry date of the drug. So the expiry is 11/2027. Then what you do, you remove the packaging of the drug. So this is what you will get. So you will get 10 ml of sterile water for injection, that is sodium chloride. You will also get a vial containing the white powder of esomeprazole sodium for injection. Then what you do, you get a goldfish. You break the glass amble. So you have to break first. You break the glass amble. Then what you do, you get the syringe from the packaging. You remove the cap of the needle. So you have to withdraw all the sodium chloride, that is the sterile water for injection, from the glass vial. Then you incorporate or dilute it with the vial containing the white powder of esomeprazole sodium for injection. Then what you do, make sure you remove any air bubble. Then you put back the cap of the needle. Then what you do, you get an alcohol swabs. You open or flip off the opening of the vial. Then what you do, you clean the opening of the vial with an alcohol swab at least for 20 seconds, and you allow it to dry for 30 seconds. Then what you do, you get the syringe from the packaging, you remove the cap of the needle, then you inject the sterile water for injection into the vial. So you incorporate, you transfer all the sterile water for injection. Then what you do, you remove the needle from the vial, you keep the needle in the cap to maintain its sterility. Then you put the syringe into the packaging, you get the vial, you start shaking the vial gently until the drug is completely dissolved. So this is how you are going to dilute and prepare esomeprazole sodium for injection for the treatment of gastric ulcer, peptic ulcer, or gastroesophageal reflux disease. Then when you mix the drug, then what you do, this is how you are going to withdraw the drug from the vial. You get the syringe. Then what you do, you remove the cap of the needle. You pull back the plunger to put equal amount of air into the vial. So you put equal amount of air into the vial first before you start withdrawing. So you will feel a lot of pressure. You pull back the plunger. Again, you force the plunger into the syringe. Then you hold the vial in horizontally. Then you start withdrawing the drug from the vial. So make sure you will feel a lot of pressure when you're withdrawing the drug. Make sure you keep the needle in line with the drug to avoid air bubble rushing into the syringe. Make sure you withdraw all the drug from the vial. Then you remove the needle from the vial. Make sure first you remove any air bubble in the syringe. Then what you do, you put the needle into the cap. Then what you do, you put the syringe into the packaging. Then you have to place the drug alongside the patient's bed. What you do, you have to label the drug. So make sure you label the drug. So this is esomeprazole IV injection. Then what you do, you place the drug alongside the patient's bed. Then what you do, you follow the guidelines of drug administration. That is right patient, right drug, right dose, right route, right time, right reason, and the right documentation. Then what you do, you get an alcohol swabs. You clean the opening of the vial. You get the patient's hand. So you have to clean the opening of the cannula with an alcohol swabs prior to administration of the drug. Then you put the cap back into the cannula. Then what you do, you get the syringe from the packaging. So make sure you remove any air bubble. You remove the cap of the needle from the syringe. You get the patient's hand. You apply pressure on the tip of the cannula. You remove the cap of the cannula. Then what you do, you insert the syringe into the cannula. Then now you can administer the drug to the patient. So this is how you are going to administer esomeprazole sodium for injection. I hope you can see. Then what you do, you apply pressure on the tip of the cannula. You remove the syringe from the cannula. You dispose it off. Then what you do, you get the cap of the cannula. You attach it. So this is how you are going to prepare and administer esomeprazole sodium for injection. So thanks for your watching. See you in the next video.